Good afternoon. Still awake or deep thinking or already on the hospital bed? So I must thank you, ISHRAE Nagpur chapter, for organizing such a wonderful session with excellent topics, and on top of that, I will say the greatest speakers in the industry available. Believe me or not, I have not seen this in-depth presentation in any of the healthcare events, whether it's a national or international. And I must appreciate from the starting on the guest of honor, the chief guest, as well as the presenters like Baliga sir, as well as architect Hombre, that the knowledge they are carrying about the air conditioning is never expected from these fraternities. And the level of deepness architect Hombre was explaining, I will say he has learned from the experience side by side. And that gives an added advantage as HVAC manufacturers, HVAC designers and contractors for us to get connected easily with them and how they understand our problems. So I will be going deeper from building to the environment, to the room, to the component of the HVAC system, which also plays a major role when we talk about healthcare facilities. Because healthcare facilities, when we decide to go, the first reason is that I am going there for healing, to get cured, to get well soon. But nowadays we see a lot of data coming out, a lot of complaints, issues coming out that people get admitted for one thing and get treated for another 2-3 things. And that's very common, and there are multiple factors which we have already discussed, and I will maybe throwing more light into this. So during these discussions, I know I have a very short time because we are already running late, and I appreciate we try to grasp as much as we can during the short period of time. So the problems, what we are already seeing about the IEQ or the contaminations, but when we go deeper into this, what are the different type of contaminations? Like we were talking about particular, we are talking about gases, we are talking about bacteria and viruses. So these are majorly divided into 3 parts, that is chemicals, biological and physical, which is the particulate matters. And then what are the major causes of these contaminations getting added into the facility? Because you are not doing anything wrong inside an hospital facility or inside an operation theatre, which is going to generate this. But there are common factors or common sources, like human being himself is a walking resource for generating all these type of chemicals. Like our body is studying the particles, when we are exhaling, we are spreading the viruses and bacteria we are carrying, even the clothes we are wearing, or when we are trying to disinfect, or when we are trying to make it, I will say, more aromatic using the freshness and everything, or using the cleaning chemicals. It is also keep adding the pollutants inside the facilities. So why the contamination of high concerns, specifically into healthcare setting or the lab? What are there? So we heard about the HAIs or even the SSIs, that hospital-acquired infections. So that's what I was talking about, that we get admitted for treating one disease and then we keep treating for another diseases. Surgical site infections or hospital-acquired infections are very common across entire world. It's not only the problem in India, even in US also. Then, because of these infections, there is the birth of MDROs, where while treating with antibacterial and other drugs, the bacteria also get evolved. Like we see in the COVID, the alpha, beta, and every version, which is keep coming back, and some of them are very strong, which even life-threatening also. Then the body fluids or the pathogens which is there, which can easily get airborne. Like there was, I think, a statement from Dr. Capre that the viruses and bacteria are too small. They cannot be even arrested by the HEPA filters. Or even the Baliga sir also told about using the UV lights into inspection into the high ceiling areas. But the virus or bacteria doesn't travel on their own. They need a carrier, and the smaller particles become the carrier to transporting them from one position to another position. Then into laboratory sites, like the sample contamination, the hazardous materials, as well as the chemo deficiency, like architect Nombre was mentioning about, I have the chemo labs where I should exhaust. So even after exhausting, whether it is exhausting completely or it is again getting mixed into the room. So how it can be removed with different solutions available in the market. So these airborne pathogens are silent spreaders. Most of the time, even the doctors don't find it easily unless and until there are specific tests on the patient why it is not getting cured. Cross-contamination, we have seen in the early stage of the COVID where all the patients with all the variants were in the same room, later they were separated based on the variants. Then it also weakens the defense system of the patients as well as the healthcare workers who are continuously working around the clock inside these facilities. The fungal growth and the other thing what Balika sir explained about, it also becomes the airborne hazard, and there are some variants of that which are toxic. Then the ventilation, which is more important, like if you don't move the air within the room, even the HEPA or even the higher than that, the ULPA filter is not going to help you out unless and until that entire room goes through the air conditioning system, through the filtration systems. So the major thing is that not only the surfaces, the air has to be clean, the silent spreader has to be arrested, and then this will add as another, I will say, the type of medicine to cure the patients faster as well as to protect the healthcare workers inside the facilities. So what are the, I will say there are multiple numbers. I think I don't have data specific to India because most of the time we are still into developing and there is a database getting built by the government to collect the data from across the hospitals, but 1 out of 4 buildings in US are sick building. Then 800 million workers are getting affected. The latest data, there was a statement from the government that we don't have accurate data, the deaths killed because of the pollution, but Lancet is saying almost 15 lakhs people dying because of the pollution. Yesterday, there was a statement from the Minister of State for the Health, Dr. Jinder Singh, about India will be reaching close to 2 million population of cancer patients. Now, how this cancer goes, everybody says I am following healthy lifestyle, I am eating healthy and everything, but nobody monitors what the air we are breathing in. We don't know what carcinogenic substances will be there in the air, which will be going inside our lungs, flowing into our bloods, and then causing the cancers. So, the air quality is not only affecting the human body, as there was a comment from Dr. Kapre that in the initial stages we are setting the OT temperatures low, imagining that it has to protect the equipments inside the OT. So, the air quality is important to protect the patients as well as the costly equipments or the critical equipments inside the healthcare facilities, and that can get easily damaged because of the pollutants which is present inside the facility. So then another data about the HI is that 3.76% is overall rate. Now you can imagine how much cost is involved, how much burden on the common families of the people who are getting treated through this, and then as well as the stress on the healthcare system which is always struggling to take care of the increasing population. So when this is more critical, like there was a comment from Dr. Joshi also that they have a very good system, HEPA filters installed into their transplant room. And I will be proud to say that that has been provided by our partner TRIFOIL, supplied with AF units. So that when the patient goes to the transplant procedures, he becomes more vulnerable to getting the infections because of the immunosuppression medicines given to him to accept that part into the body. And that is the time where the airborne pathogens or bacterial viruses can attack them. So if you keep that system sterile enough, this will help them to recover faster. So when we go into the solutions, first we need to understand what is meant by filtration. And there are multiple attempts done by ISHRAE as well as ISHRAE on the guidelines and other things, but how the basic filter works. If you ask me before 6 years, being an HVAC engineer, for me the filter was only a 4-line item. EU4, 90% down to 10 microns, synthetic media, washable. Now, when I am working with a world leader in the filtration company, the filters are not washable at all, not even pre-filters. Nobody globally washes their filter other than India. And we get a request even to wash HEPA also, to save on the cost. Then how these the principles are working, like straining or impeachment or interception and all. And we are talking about the particle size of 10 micron, 2.5 micron, 1 micron, 0.3 micron, which is not visible by a human eyes. Now you imagine we are cleaning that with the solution and soap solution and the water, which is not practically possible. You are sticking that back to the filter media and becoming a breeding ground for the bacteria, viruses and mold formation. Then, what are the two different categories of the filters? The general, which is free and fine filters, which is defined by ISHRAE 52.2, as well as ISO 16890, which is the newer standard, making it more simpler for the designers as well as the architects and the healthcare professionals, making it simple that PM10, PM2.5, PM1. So what my filter will deliver? It will deliver particles lesser than 2.5 micron, particles lesser than 1 micron only. In HEPA, there are H13, H14, which are the grades specifically for the 0.3 micron particles. Then I will just touch upon the guidelines which Baliga sir already took, but then he talked about major about the air ventilation rates or ACPH rates. But there are also standards given about the what should be the minimum standard of filtration installed inside the facility across the rooms. And this is again a guideline which is need to be minimum. There is no limit. We can go on the higher side to protect or make the environment made more suitable. Similarly, NABH guidelines also saying that the velocity across the laminar flows, what should be the velocity at the patient level, that has to be followed. Now there was a question yesterday for me that I need 5000 CFM and I have this much size only. Can you give me the laminar flow to me? I said I can give you, but that will not work. Because the guideline says 20 FPM velocity at the patient level. That is because the reason that there can be thermal shock if we increase the velocity. The surgeon may feel discomfort while operating. Now you tell me that whether I should increase the size of the laminar flow or I should increase the velocity of gap of it. So that we need to understand while designing the facilities and what is non-negotiable factors in the facility. Then again about the efficiency recommendation, what should be the efficiencies for the filters in the hospitals, into the OPD areas as well as into the other areas where the patients or the relatives are coming into the hospital facilities. So coming to about us, we are the leader into the air filtration. We are having the facilities in India, in Bangalore as well as in Greater Noida, and we have TRIFOIL, who is our partner, having a stall over here where you can go and see and feel the products in practical. Then about AF, that we have been designing, helping the fraternity across the globe in getting the right products, even making the right products suitable for the application. So some of the images of the pre and fine filters, which you may see only in the catalogs, but in practical you will see the metal filters with the black, tan and see-through lights. But we should be using the right amount of the filters, and the people who will be handling these filters should be using the basic PPE like gloves as well as the mask before handling the filters. Specifically in the healthcare facility, you don't know what filter has captured and what it can spread to the other people around the facility. HEPA filters, again we will recommend to get the reputed tested filters. Not every filter will be HEPA unless and until that is properly tested and certified. Then there are other options available, because I heard about this also, the HEPA is having the highest energy consumption. So there are options available with the lower pressure drop ratings, which can save you on the consuming the lesser energy, because most of the cases the HEPA filters into the OTs have been used for almost 3 to 10 years depending on the facility, the condition of the filters and everything. So better to go for a better pressure drop rating so that you can save on the energy on the long run. Then chemical filters again has to be there in specific facilities, like when we are talking about the location. Suppose you are designing a hospital in the center of the city where you have very high vehicular traffic movement and very high pollution coming from the vehicles. So to remove the SOx and NOx coming from the vehicles, you need to use the gas phase or the chemical filters, so that it's not only about the particles, you are removing the molecules also. Similarly, the terminal modules, which can be used for the smaller rooms, because you cannot use the AHU or the laminar flow for the bigger rooms, but specifically for the minor OTs where you are doing the day care surgeries and everything, where you don't need to invest for the big amount of a laminar flow, but you can use the smaller modules which can make that room suitable for the minor surgeries. As well as there are fan powered units, because we are seeing sometimes during the specifically the brownfield projects and other thing where we don't have the enough static available in the AHU. So we can use the fan powered HEPA units, which is installed in AIMS also in Nagpur, which can help you to make that room into sterile environment. Laminar flow units, as I told, again I am discussing with NABH on this part. When you want everything in OT in SS, why you are allowing aluminium plus SS into the guidelines? The surgeon has operating table, all the tools, everything is made in stainless steel. And then in guidelines, it is giving SS oblique aluminium, which is forcing the contractors or the buyers to go for the cheaper version rather than the SS version. Then certain air purifiers which is in compliance with ISHRAE 241 or making the normal room into isolation rooms into negative pressure or positive pressure can be done with the solutions available across the shelf, and this is having entire stage of filtration like pre-filter, fine filter, HEPA filter along with UV light for disinfecting the bacteria and viruses which has been captured by the HEPA filters. Sample design of the consulting room, when the consultant is handling multiple patients per day, almost 30, 50 or some cases even 100 patients per day, how he can be protected by not getting infected because of the multiple patients he's handling, using the air purifiers into the patient waiting areas or OPD areas where we don't have a centralized air conditioning, so that we cannot upgrade the filters but we can use the portable air purifiers because we don't know what each and every patient is carrying to the hospital. Then another interesting fact we have seen for the specifically for the IVF clinics, that the VOC content and other thing can result or directly impact the output of the embryo when we are getting the IVF treatment. So we have supplied this type of solution also across in Nagpur also, where we can remove the VOCs and also we can add the HEPA filters to make the IVF lab safe or giving the better results. Bag in, bag out is again another important unit, I will say, in the healthcare facilities, which is commonly ignored. Even I have seen, even the government run TB hospitals, we don't have this system installed. And then we ask why my staff is getting infected, he is not even working in that ward. The common reason is that whatever you are exhausting from that ward is going in the outside area where the people are having the movement. So if you don't have a containment system to handle this type of pollutants, specifically the biological coming from the highly infectious wards as well as radiological coming from the chemo areas or other radiology areas, it will be keeping affected to the people who are working across the facilities. So thank you for patiently listening, and for more details you can connect us on our stall. We will be happy to discuss with you. Thank you.